The first thing I'm going to do is I'm going to make myself a target. You doing okay? It's not hurting?
Yeah, no, that's fine.
Okay. So right there's a little bit of a sweet spot right there. And so that's my target. I'm just going to move. And I'm going to move the needle in and just get a little target. See my target there?
Mm-hmm.
Always let the alcohol dry. And then the first thing I'm going to do is we're going to try to aspirate a little fluid out of there. We might not get any, but we might get lucky. Okay, a little bit of pressure as I go in. And I'm going to tilt the kneecap toward me. Usually once you get past the skin. Is that all right? Not too
Yeah,
bad?
it's fine.
It's not too bad. And if you keep a little bit of pressure on the kneecap, you can avoid doing the scraping and just angle a little bit. And now we feel the feedback as you go through the tissues. And you feel resistance. And once we go, we just have to re-angle. There we go. Slide in nice. So we're under the kneecap now. Hopefully we're in a pocket of fluid. And there's not. So we want to withdraw slightly. Turn the needle. There to see. So all we did was just pulled out a little bit and rotated. And now we're starting to get some fluid. And so we can move back a little bit more. See, the fluid can be in pockets. And sometimes you get a lot, sometimes you don't. But for demonstration purposes, if you wanted to aspirate and send this away from the lab, so like you suspected there might be some gout, or you suspected there might be some infection, you can always send it away to the lab, and you can do gram stain microscopy cultures, you can do different tests. Okay, just for demonstration purposes, that's enough. So we got it. We know we're in the joint because we're aspirating synovial fluid. And if we look at that, see, this is pretty thick. This is what you normally want to see. You want to see this sort of straw color. Now, see how viscous that is? If it's infection, it's usually very thin. It might be blood streak. You might even see pus if the patient's not very lucky. Okay, so now we have our syringe all set up. We can get some of the air out of there. There we go. And now we just come in and very gently Is that okay?
Yeah, it's fine. Absolutely fine.
Okay, now what I'm going to do now is I'm going to take the syringe away, and atmospheric pressure 14.7 pounds per square inch. See how it drips a little bit? It's not dripping on the skin though. See, what we want to do is avoid the steroid on the skin. And by doing this, we avoid any leakage. See, I'm putting a little bit of tension on there. Okay. So who wants to give me a plaster? Who wants to be an assistant? We got a plaster here anyway. There's one. You wanna?
You going?
Yeah.
Well done.
Thank you.
That was kind of like injected.
That was actually a triamcinolone.
Triamcinolone.
Yeah. Thank you. Well done.
Thank you.
Thank you.